I started my practice in 1996. Really at that time, I was doing a mixture of cosmetic surgery and reconstructive surgery. The evolution of the practice really has continued with really non-surgical tools such as M-Sculpt to shape muscle and shape the body, and then advancing into the technologies to help rejuvenate the face. M-Face is a really game changer in terms of lifting the face. All of these technologies combined have really changed the practice from first day cutting to now doing all these procedures in combination. And now we're moving on to the next phase of our practice. We've seen an explosion in what's called functional medicine, the explosion of supplements that people take, now looking at people's genetics, people's exercise routines, sleep studies. So we've got a whole new wealth of change in people's mindset in terms of how they want to live, how well they want to live, how productive they want to be, and how they want to enjoy their life and their families. Really the next step in this, in terms of the potential value to my practice, is the mind. EXOMIND is a tool that was introduced to me in January of this year, and I thought, well, these guys are crazy. Why would a plastic surgeon do this? But then I was explained that it will really help your results, help your practice, and everybody's looking to improve their lives in many different facets. And the hardest way to improve your life is to help your brain function better. It's important that this device has been brought forward after 30 years of research. Now we're looking at using a device to externally stimulate the brain using TMS, and that is just completely fascinating. The future of cosmetic surgery is really all-encompassing. I think this practice is going to evolve to having a patient come in not just for doing their breasts, but really they're going to come in and say, look, Dr. Born, I want to make a lot of changes and live a better life. I don't want to be pushed by social media. I want real medical advice on how I can make those changes. And we can start from body and work up to the mind. Now we can actually directly intervene and help with their mental well-being. So this is a whole new step and horizon that is probably lacking any type of limit in terms of helping people live their lives better. I'm excited to bring this new technology to the practice. We've always strived to provide our patients the best in care and always to be on the forefront of new technologies and new services that make their lives better.